Hi there, I'm Dr. Paul Phrampus. I'm the director of the Winter Institute for Simulation Education and Research, associated with the University of Pittsburgh and the UPMC Health System. Many of you know us as WISER. Today I want to walk you through the essential steps of conducting a needs analysis and discuss why it's important and how it can improve your simulation program's value. This is foundational work for any successful simulation-based initiative. Whether you're launching a new curriculum, redesigning a training program, or responding to changing clinical environments, a strong needs assessment ensures you're targeting real needs, not just assumptions or passion projects. This in turn will contribute to the valuable utilization of simulation resources associated with your program in the most efficient and effective way. Also, it will ensure that over time, your institution has the confidence in your ability to triage that most prudent use of financial investments made in your simulation program. So why do a needs assessment? A needs assessment helps us to identify the gap between current and desired performance. It allows us to align our simulation activities with actual learner needs, clinical priorities, and institutional goals. For example, if you're planning a new simulation on emergency airway management, something near and dear to my heart, perhaps you should ask, do our learners already have this skill? Is this a most pressing clinical need? The needs assessment brings clarity and direction to your planning. So what do? Start with data you already have or have access to through your institution. This could include national board scores, end of rotation exams, incident reports, or results of root cause analysis, or perhaps learner feedback from prior courses. Let's say, for example, multiple RCAs point to communications breakdowns during handoffs. That could be a signal to identify the need to design an intraprofessional simulation targeting that specific gap in your institution's performance. Next, engage stakeholders. And I say engage, but I also mean identify. Identify and engage the people closest to the work. Think broadly, for example. This may include some combination of learners, faculty, clinical leaders, health system risk managers, director of quality or safety officers. At WISER, we found that structured interviews or even short surveys, phone calls, and brief conversations can yield profound results. For instance, when ICU nurses were involved in planning, they emphasized the need for realistic medication administration challenges. It's something that if we didn't engage the nurses at the bedside, we may have overlooked. Analyze the gap. Once the data is gathered, define the performance gap. This is the difference between what the learners are doing now and what we want them to be doing or need them to be doing in the future. Maybe your learners are proficient at placing central lines on task trainers, but freeze up when complications arise in real patients. That's a clear indicator your simulation should evaluate and include realistic failure scenarios or perhaps scenarios that include the identification of complications that are commonly associated with central lines. Next, prioritize and plan. It's not always feasible to address everything at once, so prioritize. Ask yourself, does simulation seem like a wise solution? Is it the most efficient and effective use of simulation? Which best align with the institutional goals? What's realistic within your current resources? Do you need to plan? Do you need to budget for a major project in the future? Which gaps are most critical to your institution in terms of quality and patient safety and the mission to improve? You can even rank them using a simple priority matrix based on urgency, impact, and strategic alignment. This step ensures you're not just reacting, you're deliberately planning for the future. Next, make sure that your program is aligning the goals of any project that you embark upon with your institutional mission. This is absolutely critical. Every simulation project should be vetted to make sure it falls within your program's defined scope and mission. At WISER, we routinely evaluate proposed initiatives to see if they align with our core areas such as education, patient safety, innovation in education, research, or the systemic improvement in the delivery of healthcare. If a project doesn't support our mission, we either revise it or don't pursue it. This keeps our work meaningful, focused, and sustainable. So in short, Wrapping things up here, a needs assessment is not just a checkbox, it's a foundation. Some of the tips and steps offered in this video include finding and incorporating real data, identifying and involving your stakeholders in the planning process as well as the solution, analyzing the gap of what is actually needed, and then do that double check to make sure simulation is the correct solution so that we know that we're effectively and efficiently deploying simulation. Lastly, ensure your project aligns with your simulation program's mission and that further aligns with the institutional priorities of your stakeholder institution. Prioritize your actions and the projects that you're pursuing. So if you find this video helpful, please like and subscribe and share so we can continue to produce high-quality materials that benefit the simulation community. And I ask you to visit wisersimulation.org to keep an eye on what's going on at Wiser and what we're up to, and we offer a lot more resources on simulation-based education. Well, that's it for this one. Thanks for watching. Until next time, happy simulating.